The world has been through 2 wars, many more hostilities between nations, diseases and pandemics of the scale that we are witnessing now. But what remains constant through it all is the resilience of life. It goes on. There are many women who are currently pregnant, expectant mothers. There are many women who have infant children who were born just a few months before, when the world was a very different place. We spoke to Dr. Arun Gupta, who is a pediatrician and the regional coordinator of the International Baby Food Action Network, on some frequent questions that mothers and expectant mothers may have at this point in time during this global crisis.
First of all, during these difficult days, I would like to advise new mothers to take care of themselves and their newborn through one of an important interventions, strongly advised to continue breastfeeding their babies. Mothers in general could follow the basic hygiene principles as advised by the government during COVID, like hand washing, using a mask and keeping the surfaces clean where you frequently touch. In case you or any other person in the family is showing symptoms of COVID-19, I would say you must seek the help of a doctor near you. I think you should be fully supported by the healthcare system at the time of birth to successfully breastfeed your newborn. You can continue with the precautions as advised by the government. If you are unwell, you should be supported through safe feeding methods like donor human milk or expressed breast milk. In case you have to feed on artificial feeding, it should be used in a very safe manner, and instead of bottles, cup should be used. Hygiene standards should be maintained during this feeding. I think vaccinations, if suspended for few months, they can break the chain of protection for the disease it's being used for. Therefore, the government should ensure to continue this important intervention. It may be important, however, to evaluate the impact of not vaccinating for individual vaccines, and a decision can be taken which one can be interrupted if at all, and for how long. In the case of expectant women, mothers and pregnant women, there are two things which I like to advise on. One is that in general, it's no different from any other person when you're dealing with COVID. So all expectant mothers should follow the same guidelines, and at the same time, if you or anybody else in the family has symptoms like COVID or tested positive for COVID, I would advise you to report to the nearest health post in order to seek guidance as well as testing. For good nutrition and maintaining nutrition security, which is very effective for fighting COVID, all pregnant women need good rest and diverse foods like green leafy vegetables, foods rich in calcium, vitamin C and E, iron-rich foods, green leafy vegetables and fruits, etc. All this is the best way to ensure your nutrition security. Since it affects your health as well as the health of your baby, it becomes even more important during this epidemic. Therefore, I would say every family should ensure availability of nutritious foods, and if they cannot afford, the government should pitch in here and they should make efforts to provide such foods. I will also like her to continue taking any vitamins or supplements as has been prescribed by her doctor.
For more information on how to care for yourself and your baby at this time, there are some helpful World Health Organization guidelines. The links are pasted below that you can access for ready reference. And if you know somebody who doesn't have access to such kind of information, if you know some women who are pregnant and who are going through this period without much medical care, support or advice, then don't forget to call them up and share this advice with them.